to another episode of Dr. Aid. Today, we would like to discuss a very important topic, which is prostate cancer. As we all know, we are in the month of September, which is one of the most important months where we do what we call prostate cancer awareness. So now the question arises, what is prostate cancer? It is basically the cancer of the prostate. So as we mentioned, it is the cancer of the prostate. Now, what is the prostate itself? It is a gland which contains connective tissues and glandular tissues. It basically adds fluid to our semen, and its muscles help to bring out this semen through our urethra. Every disease has a risk factor. Having more than one or one of the risk factors doesn't mean that you are at risk of getting that particular condition, but then it only exposes you to such a condition. The risk factors to prostate cancer, the first one on the list is advanced age. This is typical for men who are between the ages of 74 and 79. The second one is unfortunate, but then the blacks are mostly affected with prostate cancer. The next important point is about people who inherit a faulty gene. It could be that someone inherited a faulty gene that caused prostate cancer. And the most important one is a positive family history. A positive family history basically means that if in your family you are able to find people who are having prostate cancer, example could be your father, your uncle, your brother, or your grandfather. This poses a threat to such a person, and this could lead to prostate cancer.
So what are the signs that you see when you are suspecting prostate cancer? Firstly, it depends on how early or late the cancer is. So most times in the early stages of prostate cancer, we say it is asymptomatic, meaning that you don't really see any features that shows that this person has prostate cancer. However, as time goes on, one of the things that you begin to see is that the person now has some urinary signs. What that means is that when the person goes, it's difficult for the person to urinate. As the person is urinating, there is some level of hesitancy. Besides that, there are also times where the person will see blood in the urine. So these are some of the signs as time goes on. Now, when it becomes more advanced, such patients will present more with some pain. You begin to have bone pain. You have people who also have erectile dysfunction. So now let's look at, after realizing that you are seeing some of these symptoms, what do you do? So it is recommended that from time to time you do what we call screening tests. And many times you realize that in the community, people come around who offer to do screening tests. And one of the screening tests they do is they look out for the PSA, that is the prostate specific antigen. This, when it is elevated or when it is high, will help you know if you have developed prostate cancer or not. When you are diagnosed with prostate cancer, what your doctor will do is that if it's in its early stage, they will wait to see how it progresses. If it progresses on, what they can do is that they can give you various medications. So some medications that will be given will help to reduce the hormones that are being produced. Some of them will also help to be able to destroy the cells, that is the cancer cells that have grown in the prostate. So, prostate cancer is curable, and once you have detected it early, you have a very high chance of being able to cure it. And so do not be scared or afraid. the best you can do is to contact a health practitioner, a doctor, and if it's detected early, you'll be able to cure it. Thank you. I am
your Dr. Aid for today. See you in our next video.